There are some big changes this year for the 500,000 Oklahomans on Medicare.
One of them has to do with the amount of money spent on prescriptions. Kirsten McIntyre explains the so-called donut hole and what it means for seniors trying to make ends meet.
Every year, many Part D beneficiaries find themselves in what's known as the donut hole. They must still pay their premiums but get no prescription drug coverage. But with the passage of the new health care law, seniors are now getting some relief.
This is the list that I take right here.
Every day, 79-year-old Hank Harvey takes a handful of drugs.
This is also diabetes. He's 2.
He says at his age, it's a matter of surviving another day.
That's what you do. When you get to in my age bracket, it's basically just you take these prescription drugs just to stay alive. And I don't feel a person wants to live a long time. That's all of us. It should be penalized for being old. That's what they're doing.
Last year, Harvey spent about 6 months in the donut hole. He was covered by Medicare until he reached around $2,800. But until he reached the catastrophic level of about $4,500, he was left with no benefits.
That's money that I can't use for anything else. Clothes, food, car repairs, anything. It just takes it right out of your pocket because you have to have that to stay alive. That's your first priority.
Yet with the passage of Washington's new health care law, discounts are now available. This year, those in the coverage gap will get a 50% discount on name brand drugs and a 7% discount on generic drugs. It's a bit of a break for those living on a fixed income.
That makes people be able to take the brand name drugs their doctor prescribes without going broke or having to give up food or just whatever you have to do to take the medication your doctor orders.
Harvey expects to fall into the donut hole again this year, but says at least it won't be as painful a pill to swallow.
I'm lucky I have a good pension and also Social Security. And I can see where people who don't have a pension are really up the creek because, you have to pay everything in that donut hole.
Under the new health care law, the donut hole will gradually close by 2020.
All right, Kirsten, there are also big changes when it comes to getting yearly wellness exams and preventive screenings. They are now free, which was not the case before. For a list of which screenings are now free, just go to news9.com/links. Tomorrow at 5, it wasn't